Hello and welcome to today's webinar. Today we'll be talking about Omniscope, which is dedicated to seeing what your immune system is seeing and why your immune system is a fundamental hallmark of aging. As you can see here, T cells detect and treat disease, and indeed they are the invisible army that protects you as you age. Now, what if we could decode the immune system for healthspan? Well, at Omniscope, our leadership team is singularly dedicated to this very mission with two fundamental pillars. Science, where we turn biology into data with our scientific co-founder and CSO, Dr. Professor Holger Heijn, who's part of the Human Cell Atlas as well as the Lifetime Initiative, looking to understand biology as a function of individual cells. And Matthew Sant, our Chief Information Officer, who takes the huge amounts of data that Holger produces and uses artificial intelligence to develop models to extend and better the quality of life that we have. My name is Vijay Vaswani, and I'm one of the co-founders and the CEO of Omniscope, and I spent my career in commercializing novel scientific technologies from next-generation sequencing through to viral diagnostics and machine learning, all the way to the analysis of single cells. And I'm very happy to be able to present our work today on how Omniscope intends to increase healthspan, that is, the quality of healthy years that we have. And indeed, this work is built on solid science. Our scientific officer, Holger Heijn, has a myriad of grants and international collaborations, and in particular has focused on some of the most interesting facets of age, all the way from single cell human atlas projects, where we actually create atlases made up of cells, which are the smallest unit of the human body, and how those change over time, as well as looking at specific elements such as the plasticity and aging of skin, the way human eggs or oocytes actually age in women, all the way through studies looking at the immune systems of newborns through to centenarians. Indeed, at Omniscope, we take this science to truly understand age as a disease. Why is it that the chances of death exponentially increase with age? Why is it that a myriad of diseases come about, from cancer, stroke, heart disease, through to infectious disease? And the question is, can we intercept this age-related damage before it occurs? Can we track it, and can we intervene? Indeed, what we notice with age is that your immune system is playing an absolutely critical role. You see, your immune system is incredibly diverse and has a huge network of cellular soldiers to protect you from all diseases. What happens when you age is that gaps occur in this cellular army. They are no longer the cells that you need to defend you from disease when you need it most, at your advanced age. Indeed, the aging of the immune system is one of the hallmarks that we must intervene on. And in fact, there are clearly documented examples of infectious diseases which can also reduce your ability to respond to disease, which accelerate ages, such as cytomegalovirus, which actually takes up a huge amount of your immune space. So how do we understand the aging of the immune system? How do we find these gaps? At Omniscope, we do this by reading millions of cells through our proprietary technology, where we look at individual immune cells at an unprecedented scale. Here we really generate biological data so that we can use interpretive AI to understand the gaps and match them to existing and approved therapies. But we're also ready for the future. We are biobanking immune cells so that we can preserve your cells for a moment in your advanced years where you can leverage them to extend life potential. And we have actually shown our ability to write or edit the human immune system in cases such as cancer. So this foundational model, this ability to read and understand the immune system, is our core asset. It is the world's largest immune database, which we have built across multiple diseases and across the age gradient. We have scoured the world to ensure that this is gender and age representative so that we can truly build a model of age at a cellular level. The Omniscope model of age looks at the fundamental, scientifically validated hallmarks of aging across the immune system. Whether that is protection score, senescence, or, for example, telomeric length, we've also benchmarked this with gold standard references such as the Howard or the methylation clock. Indeed, it is this very model of age that allows us to look at one of the case studies I'm going to present to you here, which is your protection score. What is the strength of your cellular defenses? How can we understand your protection score so that you can make informed healthcare decisions? And for longevity clinics, what is the actionable insight for your longevity customer to be able to enhance their immune defenses so that they can live longer, healthier, disease-free lives? Let's zoom in into some case studies. Chickenpox is a disease which we encounter in our infancy. Most of us develop natural immunity, but as we age and reach our older years, we no longer have the protection to control the virus, and it often comes back in what is colloquially known as shingles. Let's take an example here where we've seen childhood exposure to varicella zoster or chickenpox, and we've tracked the patient from pre-vaccination through their first dose with GlaxoSmithKline's Shingrix vaccine through to their third dose, which is designed to induce longer-term protection. Well, how do we know if this is working? Here we can actually see the before and after scenarios. On the left-hand side, represented with orange dots, we can see that populations of pre-existing T cells have now actually been elicited to copy and replicate themselves so that the exposure from the past can be brought back to the forefront and protect you. We can also see that the vaccines create a de novo response or a new response in the immune system as depicted by the green dots, which represent populations of cells which have been elicited to emerge. What do we see in the second dose, which normally occurs roughly 6 months later as part of the therapeutic regimen? Here we can see that the second dose did not elicit the same quantity of response, but has also created more pre-existing clones to come to the forefront, as well as some de novo responses. So here we've really gone through understanding that this patient had gaps in their immune system related to chickenpox, matching them to a approved GlaxoSmithKline Shingrix vaccination, and following that over time in the before and after, as well as the second dose. This is an example of tracking an infectious disease which is brought back into focus by age. Well, the other example that we have, which is very known to many of us, is COVID. Here we follow an individual over 2 years through from infection all the way to vaccination and booster shots. And what we can really see here is the ability to track these dynamics over time. This type of information is required to answer a critical question. When should I take my booster shot? What is the optimal timing? Has my vaccination induced my immune system to respond? Bear in mind that as we age, our immune fitness or our ability to respond to therapies such as vaccines is diminished, whilst our susceptibility to severe responses to, for instance, infection by COVID increases. So it means that our immune system is getting weaker and our ability to actually tackle the infection is also getting weaker. Therefore, in this example, going from April 2020, we follow the response to infection, and in red, we follow the response to vaccination. And what we can see is that booster shots over here have actually elicited a lower than desired immune response as compared to the first vaccination and infection. This really informs timing of boosters and informs the ability to track vaccine efficacy. As we grow older, we also encounter diseases such as cancer with a greater frequency and severity. Fortunately, technology has been advancing. Fields such as personalized cancer vaccines means that there is increasingly technology to design personalized therapy. Here we follow a patient in their advanced or older years who is being treated for ovarian cancer by a personalized vaccine over 10 doses. Once again, we would want to know, is the therapy working? And what is the response per dose? Many of these diseases will require treatment at multiple times. And once again, what we can see in the scatter plots and longitudinal tracking is that these vaccines are inducing pre-existing responses. These are immune cells which have previously encountered a tumor and are reactivated by the vaccine, as well as new or de novo responses where the immune system here in green is showing new populations of cells looking to fight that very tumor. And we see similar dynamics after vaccine dose 3. On the right-hand side, once again showing both pre-existing and de novo responses. This is mission critical in your older years as you require therapies to extend your health span. Omniscope has actually published in the Annals of Oncology our work not just to track therapies, but to use your immune cells as a living drug, in this case, in a pediatric or childhood patient in a rare rhabdoid tumor. The ability to use artificial intelligence to select cells and to engineer immune cells, which are then validated to kill cancer cells, is groundbreaking and is a fundamental part of Omniscope's protection score suite of algorithms. Now, the model of age is a complete model with well-validated and peer-reviewed hallmarks of aging, specifically looking at the element of the immune system. We have also shown that one of the most important hallmarks of aging, inflammation, is actually dynamic. It can be changed. And we've shown this in a scientific publication with our partner, Football Club Barcelona. Here we have actually shown that by integration with wearables such as GPS data, but for many of you in longevity clinics, this would be your Apple Watches, Oura Rings, and other wearables, we can actually see that inflammation dynamics are measurable and are treatable. Because of the huge database we have, we can actually show here that some athletes have the same inflammation as a psoriasis patient, which obviously is an autoimmune disease which causes elevated inflammation. And we can actually separate athletes and non-athletes into acceptable levels of inflammation and elevated levels of inflammation which require an action such as non-steroidal anti-inflammatory drugs. Indeed, the good news is that if you are able to measure it, you are able to treat it, and indeed inflammation is modifiable even within the same season, making this a truly actionable piece of information for longevity clinics and your customers. Tracking inflammation and understanding the way we respond to nutrition, sleep, as well as other dynamics is absolutely essential, as well as the integration of wearables into our model of age, which allows us to continuously personalize the model of age to your customer down to the last cell. Indeed, this ability is an ability which extends from athletes to citizens, and I would like to actually show you what the actual product looks like. Here on my screen, you can see our product showing complex science simplified. We've taken prevention, protection, recovery, inflammation, and we've turned these very complex cellular dynamics into easy to understand scores without sacrificing the science. We also showcase our ability to track elements such as nutrition and actually look at their impact longitudinally, just as you would take a supplement in order to increase your health span and reduce aging velocity, and would want to know pretty quickly whether that is working or not by mediating your immune system. Complex immunology, cutting-edge science, peer-reviewed and validated AI models to advance the field of longevity by bringing you the very same science that has been used in pharma, elite sports, now to longevity clinics, is very, very meaningful, and we believe it will accelerate the journey for both longevity clinics as well as longevity customers and individuals who are very, very keen to measure their immune system cell by cell to extend their age. Now, the vision of Omniscope is to truly monitor health so that you can make data-driven decisions. This starts with establishing your healthy baseline. By understanding your immune system in your healthy state, we can track deviations. By integrating imaging data such as CT scans, X-rays, standard blood tests, which you can upload into our models, as well as digital biomarkers, whether those are wearables or Oura Rings or other devices, this allows us to continuously monitor your vital health from your heart rate, sleeping patterns, and blood and oxygen levels, as well as one of the most powerful interventions to extend your health, exercise. Here we really use wearables to identify early unknown events, to complement that with an Omniscope test where we read millions of immune cells from your blood at unprecedented resolution, to truly then track and understand the impact of therapy over time. It also allows us to non-invasively monitor therapies as you keep on going through life. And in the case of disease recurrence, What was previously unknown is known, and by knowing, you can act and make changes to return you to your healthy state, to optimize your longevity, and increase your health span. Thank you for your attention today, and I wish you a long and fruitful life.